Hello everyone, my name is Andrea Oliveira and I will present the work that Dr. Espanha and I are developing in the field of communication in health that started in 2015 and will finish in 2020. Our communication at the Congress is titled The Promotion of Health Literacy in the Portuguese Media. The aim is to know if the information that promotes health literacy is in the agenda setting of Portugal. To support our research, we can see that the access to information that gives more autonomy to people implies that health professionals and institutions must redefine their position in relation of the user. The principle of autonomy is reflected in the health system and therefore become more important in healthcare. On the other hand, health literacy, defined as the capacity that people show to obtain, process, and understand basic health information to take appropriate health decisions, is a field of study in full expansion. In that sense, we identified studies that demonstrate the link between the presence of health topic on the agenda setting and its influence in the development and promotion of health literacy. Moreover, the process of the empowerment of individuals in the development of health literacy constitutes one of the main objectives of the communication in health. One of the actions of health promotion via education is to communicate information health through the different media and channels of communication. From what we explained, we established two research questions. First, does the information that forced the development of health literacy, IF8L by now, already shows visibility in the Portuguese media? Second, what kind of information that could promote the construction of health literacy receives most media coverage in Portugal? Regarding the methodology applied, it was a qualitative study and the research was developed on the journalistic information published in the main media in Portugal. The Universe of Analysis was the new published by the main Portuguese media in 2015. The selection of our sample was made through barometer of Centro de Investigação e Estudos de Sociologia de Portugal. They applied the methodology of Pew Research Center, a North American methodology which allows identify the overall agenda setting of the Portuguese media. Finally, our research sample was 945 pieces of information about health. Regarding the analysis data, we evaluate the level of the visibility that information that forced health literacy has in the media. The level of presence was checked for indication of the existence or not of news with content alluding any of fields in health considered healthcare, prevention of disease, and promotion of health. Moreover, we checked if the news was in the headline of the media. On the other hand, concerning the second research question, we checked what kind of information of health literacy appeared in the news. To collect this information, an analysis matrix was created based on a research conducted in Europe that compared the degree of development of health literacy in 8 countries of European Union, which covered topics on healthcare, prevention of disease, and promotion of health. Which result have you obtained at the moment? Regarding the first point, the visibility of information that promotes health literacy in the Portuguese news media, the result indicates that in approximately 25% of the news, it's possible to find information that promotes health literacy. Besides that, concerning the relevance of news with IF8L, we can observe that on the totality of news with information that promotes health literacy, around 75% of news is not in a headline of the journalist's information. and only in almost 25% it is happening. Concerning the second research question, examine the categories of subjects that foster health literacy, we can see that there is a group of topics which predominates in the news media, around 20%. This group of topics includes health policy and medical treatment, marked in green. In contrast, we can identify a broad group of topics with almost non-existent coverage in all of China's public information, less than 5% of occurrence, marked in yellow. In this group, we can find topics like promotion of health behaviors, monitoring clinical signs, symptoms of disease, medical emergencies, and being and staying healthy. What the results tell us. On the one hand, it was observed that information promote health literacy show a low level of visibility in the Portuguese news media. Indeed, approximately only 1 to 5 news items related to health with IFHL was publicized in channels analyzed in 2015, with an annual average of less than 1 news item. This low visibility does not corroborate what the specialized literature stresses about the topic, the defense of a higher level of visibility of information about health, which fosters the literacy of user patient in the media so as to increase the use patient knowledge and education in this subject. On the other hand, when we analyze the topics with information that fosters health literacy that the Portuguese media reported during 2015, we found that they concentrate their attention on a few subjects. In that year, the media, mostly around 45%, publicized topics involving health policies and medical treatment. Those results indicate that the police news address more subjects related to the curing of existing disease and public health policies, the activist role of institutions, in detriment of subjects that drive a higher encouragement of preventing health risks or having healthier lifestyle, and promoting the individual autonomy of the Portuguese in health matter, the active role of youth patient. This fact could clearly limit the perception of issues on health literacy in Portugal and the knowledge and education of Portuguese people in these matters. Finally, the preliminary evidence of this study points to a low degree of visibility of information promoting health literacy in the Portuguese news media, with its focus being in a few topics whose nature does not increase the autonomy of the citizens in the management of their own health. Thus, we can talk of news media coverage that generates an insufficient and efficient vision for the development and empowerment of the Portuguese in their health literacy. Here we finish our presentation. Thanks for listening.